The listening part of the occupational English test has 3 parts, and in each part you hear a number of different extracts. At the beginning of the test, you will hear a beep sound. You have time to read the questions before you hear the extracts. You will hear each extract once only. You have to complete your answers as you listen. At the end of each test, you will be given 2 minutes to check your answers. Part A. In this part of the test, you will hear 2 different extracts. In each extract, a health professional is talking to his patient. For questions 1 to 24, complete the notes with the information you hear. Now look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a doctor talking to a patient called Mrs. Melissa. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, doctor.
Good morning. Please be seated. May I ask why you have come to see me?
Well, I have had a sudden onset of pain by lifting a weight of about 40 pounds at my workplace. I have developed pain on my left hip. Although the pain is dull, it is aching and stabbing. The severity ranges from mild to severe. The pain is present constantly and worsens while sitting, twisting, lifting, or riding in a car. The pain improves after resting. Sleep alteration due to pain is positive, and I wake up after getting to sleep. I'm feeling depressed all the time due to this persistent pain and have lost my interest in all activities. I get insomnia, lack of concentration, fatigue, and loss of energy.
Do you have pain on your spine?
Yes, doctor.
Your age?
48, doctor.
Are you attending your work?
No, doctor, I am not going to work.
Have you been immunized before?
Yes, doctor. I had flu vaccine 2 years ago and pneumonia vaccine 5 years ago.
Do any of your family members have a history of illness?
My father is 79 and had a cerebrovascular stroke and hypertension. My mother had a congestive history of heart failure and died at the age of 70.
Tell me if you have any past medical history.
I had an appendectomy 7 years ago and a cholecystectomy 3 years ago.
Do you drink or smoke?
I used to smoke before, but I have stopped smoking nowadays, and I drink socially.
What medications are you taking now?
I am taking Lortab 10 milligrams whenever I get pain.
Are you allergic to any medication?
No, doctor.
Well, your MRI shows small central herniated nucleus pulposus at L4/5, bulge at L3/4. There is a shallow left parasag, herniated nucleus pulposus at L5/S1. There is an entrapment of the superior gluteal nerve in the aponeurosis of the gluteus medius left, and you are also suffering with depression and sleep disorder. So I would recommend you take a treatment for superior gluteal nerve block left. I am going to prescribe you baclofen 10 milligrams before bedtime, flurbiprofen 100 milligrams twice a day, hydrochlorothiazide 25 milligrams once in a day, and Klonopin 0.5 milligrams before bedtime. Continue these medications for 3 weeks and meet me thereafter for a scheduled follow-up for medical management and reevaluation of your condition. Depending on your condition after 3 weeks, I will decide if any diagnostic or therapeutic intervention is required or not.
Okay, thank you, doctor.
Extract 2. Questions 13 to 24. You hear a physician talking to a patient. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, doctor. Good morning.
Good morning. Please be seated. What's your problem?
Well, I have been facing this problem with respect to tonsils for many years. I have throat pain.
Do you feel any difficulty in swallowing?
No, doctor, but I have got this habit of snoring loudly.
Do you get sleep apnea episodes?
No, doctor. Often I am a mouth breather, especially at night times, doctor.
What's your age?
17. I had 3 bouts of tonsillitis this year. On an average, I get about 4 bouts of tonsillitis per year.
Okay. Have you had any illness, treatments, or surgeries earlier?
Yes, I had a cholecystectomy.
What medicines are you taking now?
Nothing, doctor.
Is there any family history of illness?
Well, my sister has ear infection. Rest of my family members have history of cancer, diabetes, heart disease, and hypertension.
Well, your physical examination results show your pulse is 80 and regular. Temperature is 98.4. Weight is 184 pounds. Your tongue, lip, floor of mouth are noted to be normal. Oropharynx does reveal very large tonsils measuring 3 plus or 4 plus. They were exophytic. Mere examination of the larynx reveals some mild edema of the larynx. You have enlarged tonsils. You have developed chronic angiotonsillitis with angiotonsillar hypertrophy, upper respiratory tract infection with mild acute laryngitis. You have obesity issue. I would recommend that you go for angiotonsillectomy. The risk may include bleeding, infection, scarring, regrowth of the angiotonsillar tissue. There may be need for further surgery, persistent sore throat, voice changes, etc.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a dietitian talking to a patient. Now read the question.
So what seems to be the problem?
I feel such a failure. I'm sure people think that if I just tried harder, I could lose weight. Maybe I need more willpower.
Well, firstly, well done for seeking medical help. Actually, being overweight or obese is a medical problem because being overweight changes how your body works.
Oh, thanks, but I do feel that it's my fault for being this way.
Well, I hear what you say, but please understand that these days we consider that obesity is a disease, like high blood pressure or asthma. You see, the body's signals to the brain stop working correctly when you're overweight, and with time you feel less full, even if you eat the same amount. And when you cut calories, your body tries to use less energy to keep your weight the same.
Question 26. You hear members of a hospital committee discussing problems in the X-ray department. Now read the question.
So next on the agenda is the problems in the X-ray department. Nick, would you like to fill us in here?
Well, as you all know, this is a very busy department, so we have 4 X-ray machines in all, including one in the fracture and orthopedic clinic area. But recently, one of the other X-ray machines developed a fault, and so we had to apply for authorization for the purchase of a new tube for it. There's been some kind of hold-up with the paperwork, and while we've been waiting, patients are being brought into the fracture and orthopedic area for X-rays there instead. And of course, that's causing further congestion.
Question 27. You hear a senior nurse giving feedback to a trainee after a training exercise. Now read the question.
Okay, that went quite well, didn't it? But it took you a while to work out where the CPR board was kept.
Yeah.
So, what does that tell you about this scenario?
We need to check where things are before doing anything else.
Exactly. And of course, it takes a second or two to put the head of the bed down, because you've got to have that part of the bed flat before you slip the board in. I wish there was a quicker way.
So, do I put the CPR board under, or would I normally hand it over to somebody else?
It makes no difference as long as it's done.
Question 28. You hear a trainee nurse asking his senior colleague about the use of anti-embolism socks for a patient. Now read the question.
I noticed that Mrs. Jones isn't wearing the usual anti-embolism socks, but I didn't want to ask her why not because she was asleep. Is it because her legs are swollen?
Well, sometimes we don't recommend the socks if there's severe swelling with edema, but that's not the case here. Mrs. Jones was actually given them initially on admission last night, but she told us this morning that her lower legs were feeling numb. She described it as having no feeling. Until we've checked out the reason for that, for example, it could be an underlying condition which could damage her arterial circulation. We're reducing the risk of thrombosis by pharmacological means.
Oh, I see.
Question 29. You hear a vet talking about her involvement in the management of the practice where she works. Now read the question.
At first, when I took over the financial running of the practice, I felt rather thrown in at the deep end. I really needed to know my stuff and be super organised, especially with the number of new drugs and treatments available now, all of which have to be very carefully costed. It keeps me super busy, but monitoring stocks and so on helps give me confidence and allows me to see how everything fits into the overall picture of working as a vet. My manager's more than happy to leave me to run this side of things. He's in overall charge, of course, but I can always go to him if there's a problem. I keep him closely informed of what's happening. He's always pleased if I manage to make savings anywhere.
Question 30. You hear a physiotherapist giving a presentation about a study she's been involved in. Now read the question.
I'm a physiotherapist, and I'm presenting our poster about constraint-induced movement therapy for children suffering from partial paralysis following brain surgery. We did a case series of 4 children who'd all undergone hemispherectomies. They were admitted to inpatient therapy within 2 weeks post-op and began therapy 2 to 3 weeks post-op. The therapy continued after they were discharged. Our findings were that 3 of the kids regained excellent function and mobility with ambulation and upper extremity function. 1 didn't do so well, unfortunately, but he gave up the therapy early on. This type of movement therapy has been used a lot in adult populations following stroke. The findings here promote moving forward with further research on the pediatric or adolescent population following either hemispherectomy or other surgeries to help us decide how appropriate this therapy would be for them.
You hear an interview with a physician called Dr. Tadita Hussain, who's talking about treating patients with cystic fibrosis. Cystic fibrosis is a condition that causes mucus to be thicker and stickier than it should be. Dr. Tadita Hussain specializes in cystic fibrosis treatment and is here to share her thoughts on caring for people with the condition. Tadita, can you tell us a bit more about patients who suffer from cystic fibrosis?
Absolutely. Sufferers tend to carry 2 to 5 times as much salt in their bodies as those without the condition, so you can see why their mucus is thicker than average. Treatment for these patients is usually quite time-consuming and repetitive. Patients are often required to stay in hospital for long stretches, and as the symptoms of the condition begin to present very early on in the patient's life, many of my patients are young people, and so we tend to see lots of patients with cystic fibrosis finding these hospital visits frustrating.
Right.
In fact, throughout the UK, about 80% of patients with cystic fibrosis who are hospitalised report feeling at least minimal levels of depression.
How about young patients who aren't currently hospitalized? What can be challenging about their treatment?
Well, patients can be required to take around 30 pills a day to keep cystic fibrosis under control. So it's understandable that teenagers and young people who just want to be free and independent might resent this ordeal if they think they can get away with it. One of the most difficult things we have to contend with is the fact that if patients stop taking their medication or doing their daily breathing treatments, their condition won't immediately worsen. Instead, it will gradually become more severe until they contract a serious infection, which puts their lives at risk.
So, what approaches do you use when treating patients with cystic fibrosis?
Well, we've found distraction therapy to be extremely useful. We're incredibly lucky to have received a donation of a number of virtual reality headsets following their success in a number of treatment trials. We use the virtual reality headsets to transport the patient to outdoor settings, often corresponding to the activities they're required to do with us. When they complete breathing exercises on a stationary bike, for example, the VR headsets display a virtual outdoor bike ride. Our patients find it helpful to pretend to be somewhere else during treatment, and it's often easier for us to administer breathing treatments to patients using these headsets, as they're more relaxed when they're not focused on the actuality of the test.
So, what sorts of changes have you seen in your patients as a result of these methods?
One of my patients, a 24-year-old man with cystic fibrosis who was in hospital waiting for a lung transplant, well, he found treatment very difficult at first. He was preoccupied by his need for a transplant and frustrated by feelings of powerlessness. He would often resist treatment. We started using the virtual reality systems with him as soon as we got them, and it took a while for him to get on board, but when he did, it was like someone had breathed new life into him. Not only did he stop hindering his treatment, he actually began to look forward to it. He's even started helping us to think about other ways we can improve the experiences of our patients, like improving social interaction.
Yes, I understand that there are difficulties involved in patient communication.
We're looking into the possibility of instant messaging functions between patients, and even virtual games that they can play against each other. Unfortunately, patients with cystic fibrosis have to be kept apart to avoid cross-infection. It's just one more cross to bear for our patients, that they can't talk to those going through the same thing.
Right.
Our patients get plenty of interaction with myself and the rest of the staff, but we'd like to make sure they have access to a network of fellow sufferers too, for support and advice.
I see. That all sounds quite futuristic. Are there any other advances on the horizon for the treatment of cystic fibrosis?
Well, there's a new drug that's been in the news recently. It's a combination of lumacaftor and ivacaftor. You might know it by the brand name Orkambi. The drug works by improving the level of water and salt in the body, thereby reducing the thick mucus that causes illness and respiratory issues in those with cystic fibrosis. Even more exciting and futuristic, though, is the possibility of gene therapy, where the genetic mutation that causes cystic fibrosis in individuals is replaced with a healthy gene. This would effectively cure those with the condition and significantly extend the lives of thousands of people and remove the need for lengthy stays in hospital.
Extract 2. Questions 37 to 42. You hear the doctor giving a lecture on the effect of disrupting gut-brain communication. You have 90 seconds to read questions 37 to 42. According to research findings, disrupting gut-brain communication may affect memory and learning abilities. The link between memory and food is a fundamental human experience that we all can relate to. However, the findings have unveiled an intriguing explanation behind this phenomenon, illustrating how strongly the second brain in our gut communicates with our brain. A massive mesh of neurons termed as second brain lies inside our gastrointestinal tract. While this neuronal control system primarily functions independently to manage our digestive system, the study reveals that this neuronal control system communicates with the brain directly through a long nerve called the vagus nerve. The vagus nerve mediates a great deal of metabolic communication between the gut and the brain. For instance, the study revealed how feeding behavior initiated by hippocampus activity is directly activated by vagal nerve stimulation, mediated by signals from the gastrointestinal tract. It appears obvious that signals from the gut would be communicating with the brain in this way, allowing us to know when we should stop eating. But what if these gut to hippocampus communications covered satiety clues or more than simple hunger? Could they also impact cognitive and other memory processes regulated by the hippocampus? A study conducted on this topic that utilized a novel rodent model that terminates about 80% of gut to hippocampus communicators while still retaining fundamental brain-to-gut motor signaling. The study revealed that when this gut-brain pathway was detached, the rats displayed impaired episodic and spatial working memory. That means the rats could not effectively generate and access spatial memories provoked by the gastrointestinal system. With this disrupted pathway, a fascinating link between our gut and memory is hypothesized. When rats locate and eat a meal, the vagus nerve is activated and this global positioning system is engaged. Therefore, it would be advantageous for an animal to remember their external environment to locate the food again. The artificial electrical stimulation of the vagus nerve can increase memory function. However, this is the first study to find an endogenous connection from the gut through to the hippocampus that mediates this cognitive pathway. Interestingly, this study revealed that the specific vagal nerve disruption studied here did not affect social learning, body weight, or anxiety. The study concluded by raising a concern over the lack of research in this subject. It is recommended that common bariatric surgeries, such as a gastric bypass, have been found to reduce the effectiveness of vagal nerve signaling to the hippocampus. Moreover, a recently approved FDA obesity treatment called V-block therapy has been effective in weight loss by electrically disrupting the vagus nerve. That is the end of Part C. You now have 2 minutes to check your answers.